A new study published this week in the Journal of the American Medical Association Pediatrics found trace amounts of the COVID-19 vaccine, mRNAs, in some breast milk.
Though the Centers for Disease Control and Prevention advise breastfeeding individuals to get the shot, the passage of vaccine mRNA in breast milk and the possible exposure to children younger than 6 months was not explored in initial clinical trials. So this latest data shows more clearly that there could be potential effects the vaccines could have on infants, even ones who are not vaccinated, serves as a caution to mothers breastfeeding within the first 2 days of getting the vaccine. Obviously want to be tremendously careful here because we don't know what that effect might have on a newborn, if any. Right. But we don't know that, and neither do they, apparently, because this was not something that was looked at closely, and now it has been demonstrated. As some people suggested, some people we'd had on the show said, does this mean it's going to be in breast milk? And there you have it. Yeah, so again, to be clear, there's trace amounts of lots of different kinds of things in breast milk. It's why women pump and dump. They'll go and have a glass of wine and then get rid of that load and then continue breastfeeding their babies. And it may or may not be the case that could be advisable and a way to get around this kind of presence of a vaccine in the milk, if it is even a problem at all that there is trace amounts of vaccine in the milk. But, a lot of guests have made this point, that the kinds of unknowns that were really acceptable earlier in the pandemic, when the risk of not having vaccines circulating was very high because the virus was rampant, people were dying at high rates, hospitalizations were overwhelming our hospital system, et cetera. The calculation is different now that we're farther down the trajectory of this pandemic, and there has been more time that has passed that has allowed us to test some of these things and get to the bottom of some of these things. So this is one of those issues that has been a concern for folks, and hopefully now can get vetted so that people don't irresponsibly not take a vaccine when they're indicated to get a vaccine because they're worried about something that isn't actually a problem, or in the alternative, should be taking some kind of action. Right, because people deserve access to actual reliable information about what the effect of these vaccines are, what are the potential benefits, and what are the potential downsides, if any. I'm not saying that there are, but that needs to be explained. And everyone just has to get the vaccine or the booster and do it every year, do it routinely. That might not be true for every person. There might be different calculations depending on, are you about to be breastfeeding? Are you not in a high risk category? Are you young, about to be breastfeeding, where you couldn't really point to? Maybe there are very unlikely negative side effects as well, but maybe there are very unlikely positive side effects, given that it's not keeping cases down. And in most people, especially if you could have already had COVID, even a different strain, offering you some protection against severe disease, not against transmission, but severe disease. It's different people are different. And that's the way healthcare is supposed to work in general. Talk to your doctor, ask someone who knows something, get a second opinion if you want it, consult, listen, I guess, to what the CDC is saying, not saying don't, but they don't know what your situation is. Yeah. You have to ask your doctor about your situation.
Yeah, which is why, I don't mean to make everything about this, but I do think that there is something that we lose when we don't have most Americans having a relationship with a general practitioner, either because they don't have health insurance, or because they do have it, but they're worried about the costs that accrue, a lot of unknown costs that accrue when you go and visit the doctor. Or, I had to confess to someone the other day that I've moved to DC in the context of a campaign and a pandemic, and haven't set up all my primary care providers here in a new city.
I don't have a primary care provider. I go to the walk-in clinic when I'm ill, and it's a horrible experience. Yeah. Absolutely horrible.
Yeah, I think that's where a lot of Americans are. And I think culturally it is bad for the long-term health of this country.
Yeah, I think so too.
Yeah, but we are finding out more and more about coronavirus vaccinations as new studies come out, and breastfeeding women aren't the only ones who are learning more about what's going on with them in their bodies. New research published in the British Medical Journal confirmed what many women had reported, which was that their monthly cycles were irregular after getting the COVID shots.
The study examined nearly 20,000 people from around the globe by using data from a period tracking app called Natural Cycles, and on average, vaccinated people experienced a 1-day delay in getting their periods. Those who did not get the vaccine did not.
Questions remain, but the study did find that the disruptions were temporary with no changes in menses length. See, this is interesting to me because app use is very contingent on how busy you are and what's going on in your life. And I can imagine a world where if you, let's say, had negative effects of the vaccine, you might not be like keeping up with your app, and there might be some delay for that reason. Although I will say, not with the vaccine, but with the boosters, I did experience a much longer delay than 1 day.
Really?
And that was very unusual. And I've spoken to many of my friends and family about
I've certainly heard this. I've certainly heard this from
It's very
women.
common. I'm actually surprised that this study didn't show
a
more
larger,
of a delay.
Same. Yeah, because I've also heard that from people.
Yeah.
Yeah. So it's something to be aware of, something to keep following, and people deserve the actual information so they can make informed medical decisions.
And it didn't obviously make me make a different decision about getting vaccinated or boosted. And I know that you talked on the show yesterday.
I got it last night.
I got it last night.
So I got the bivalent in this arm and my flu shot in this arm. I'm still here. The old ticker's going. I haven't felt any. Actually, the booster shot did hurt more than the flu shot, but it's a little bit sore. But I worked out this morning. I lifted weights. I'm fine.
Braggart.
Yeah, had to get that in there.
All right. Well, we were joking in the makeup room earlier that do we have to worry about myocarditis and the risk? And the makeup artist and I were both like, Robby, you're not young enough to worry about that. Don't worry.
After that, they had to shower me with compliments to keep my ego up high enough to even work in these conditions. More rising after this.